There we go. As we get started, I just want to give a disclaimer here that this is a really sensitive topic. When we talk about stillbirth, it can bring a lot of feelings, and we just want to encourage you to take care of yourself. If you need to step away, if the webinar is just not for you today, please take care of yourself. We will not be offended if you leave the webinar. We will send out the slides, we'll send out the recording. So if you're in a better place to watch it, we would love for you to engage with us at a time when it feels safe for you. Also, you'll hear some research today that refers to gender-specific language, and we want you to know that Count the Kicks is for every expecting parent. We just respect the parameters of research. And we are thankful today. I've got Kim with us today. I think Kim may want to just say a quick hello, but we're thankful to the Maine CDC for sponsoring us. Kim, I'll be quiet so you can talk if you'd like.
Sure, yeah, no, thank you and welcome everyone. We appreciate you being here. We're really excited to get this going here. And if you have any questions, feel free to reach out to me as well.
Thank you. And we love working with the people of Maine. We're really excited, and Kim is a fantastic partner. So thanks for being here, and thank you for sponsoring us. So I'm Sarah Coleman, and I'm the State Expansion Director. And my job at Healthy Birthday is to work with the implementation of Count the Kicks. So as we roll out in states, I support the information that's going out. I make sure that all the materials are available, and I provide the bulk of the education. I also help provide connections in your state. So you are lucky to have great community advocates and ambassadors in your state. I know Shauna is here with us today, and I'll introduce you to them at the end and just let you know how to get a hold of them. So thank you so much for being here with us today. And I also want to make space to recognize my coordinator, Sarah Hybels. Yes, we're the Sarah duo, so we go by our last name in our organization. And Hybels is on the chat for us today. And just if you missed it, we are having some pretty interesting weather here in Iowa. Hybels had tornado sirens going off in a meeting earlier this morning, and I am anticipating that that will hit us during this webinar as I'm just east of her. So we're going to go hard in the paint and make sure we can get as much information to you as possible. So let's get started just to kind of give you a little more information about the purpose of Count the Kicks and the technology that we use.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the third trimester.
For the ECOFs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
So I know that according to what we learned in the chat about everybody, people are familiar with Count the Kicks. So just want to reiterate that this is a highly effective program. It is geared towards preventing stillbirth where stillbirth is preventable, but it also serves as an early warning system for maternal morbidity and potentially maternal mortality. And we have saved lives in 36 states and 5 countries so far through this program. And this is so easy to implement and share with those that you work with. So thinking about this with the nursing hats on, it's been a little while since I was a labor and delivery nurse, like 20 years, but there are some things that I think really resonate, especially when we get to kind of the myth busting about the role of a nurse and just the importance of the education that is provided. So just to kind of level set about stillbirth data, we want to share with you, these are the most recent numbers that we have from the CDC and from the Centers for Disease Control, the national one. I realize we have a Maine CDC as well. And we know that throughout the nation, 1 in 175 pregnancies end in stillbirth. We also recognize, as you can see from the data here, that there are wide disparities. Certain populations are definitely impacted more so than others. And really a kudos to the work that the Maine CDC has done. They have really invested in making sure resources are available in multiple languages. We'll show you those languages as we get going here and talk about materials. But we are absolutely working with the folks at the Maine CDC to meet the communities where they are, so that we are working to reduce the disparities and not widen the gap. And that's really important for us as an organization. So what does this look like in Maine? Maine loses an average of 69 babies a year to stillbirth. So that you can see the rate there, but we believe that we can save about a third of those babies, or 22 babies per year with Maine, just by implementation of Count the Kicks. And here is a cute baby save, and this is a Maine baby save. This is Cooper. So I just want to share with you a piece of Cooper's story. Father's Day 2016 was one of the scariest days of my life. Around 6 p.m., I noticed that my son was not moving at all. I was 35 weeks pregnant. My husband said we were going to the hospital. My son failed a biophysical profile, and we were told that he was being delivered that night. He was born about 12:30 a.m., and he was perfect. But his medical needs then spiraled out of control, and we later found out that he had an in utero stroke. And if we had not gone to the hospital at the time we did, my son would have died. I felt silly going in at the time because I was always told that babies move less because they are growing, but that is just not true. They do not move less. The movements are different. Never feel silly or ashamed for going in or calling your OB if you're worried, because that could save your baby's life. And so on that note, I'd like to share with you another video here that talks about the link between intuition and trusting intuition, and the link that we find with fetal movement monitoring and the reduction of maternal mortality. So here's Rose. I'm hoping this works.
Moms and babies are dying at alarming rates in the U.S., but I'm here to tell you it doesn't have to be this way. Hi, I'm Rose Horton, board member of Healthy Birthday, Inc., the nonprofit that created Count the Kicks. I'm also an executive nurse leader and founder of Not on My Watch, a hashtag and a movement that I created that went viral after the number of maternal deaths in our country started to skyrocket. Not on My Watch is a call to action for nurses that no more moms should die on our watch. According to the World Health Organization, the United States is the only developed country with a consistently rising maternal mortality rate. Every year in the United States, around 1,000 women will die from childbirth complications, and more than 21,000 babies will be born still. Unfortunately, racial disparities in birth outcomes persist, and Black women are 2 times more likely to endure stillbirth.
Uh-oh. Hold on. Oh, no, sorry, hold on. Let me skip up there. Sorry,
Moms and babies,
adjusting the
around
volume.
1,000 women will die from childbirth complications, and more than 21,000 babies will be born still. Unfortunately, racial disparities in birth outcomes persist, and Black women are 2 times more likely to endure stillbirth than white women. They're also 3 to 4 times more likely to die. Indigenous and Pacific Islander women are also at greater risk. Because of the soaring maternal mortality rate in our country, Healthy Birthday created a report on the link between stillbirth and maternal mortality and morbidity, which includes firsthand accounts from American women. We have a recent example with the Kansas City chief cheerleader, Crystal Anderson, who suffered a stillbirth, and then a few days later, she died from sepsis. Research shows that more than 15% of maternal deaths within 42 days of delivery occur in women who experience a stillbirth. Studies also show that stillbirth is a significant contributor to severe maternal morbidity. The health of a mom and the health of her baby are intrinsically connected. When one is struggling, there's a strong chance that the other will struggle too. But there are warning signs, red flags, ways for expectant parents and providers to have an early heads up that something may be going wrong in a pregnancy. The CDC lists a change in the baby's movement as one of the 15 urgent maternal warning signs. Babies in the third trimester are just like us. When we are sick and not feeling well, we want to lie in bed or on the couch. The same thing is true for babies. If they aren't doing well, their movements will change or become weaker. This is that early red flag and a reason to call the doctor right away. By helping moms learn to be alert to changes in their baby's movement patterns, we will have more opportunities to intervene when we can. Our researchers include firsthand accounts from 8 women who share how speaking up about a change in their baby's movement not only helped their baby to have a safe arrival, but also identified and addressed pregnancy complications that put mom's life at risk. The report discusses how increased education and awareness around fetal movement monitoring may help to improve birth outcomes, not just for babies, but for moms too. We encourage you to read this report, share it with colleagues. We also invite you to help raise awareness about Count the Kicks, a proven, evidence-based program that is saving the lives of babies and in some cases, moms too. Thank you.
Okay, so, whoops, excuse me, frog in my throat. Rose is so chill about that, right? Like, but she does a really, really nice job of introducing some of the research that we lean into. I just want to highlight a couple other points here about our program. So we are based on something called the Norway study. If you are familiar with Healthy Birthday and how we got our start, we're founded by 5 lost moms. And when they engaged with one another through their social introductions, the thing that they came away in their initial discussion was they didn't want this to happen to other people. They felt like the 5 of them in the same town experiencing stillbirth around the same window of time was too much, and they did not want anyone else to experience it. And so they set out to find out more, to figure out how they could prevent stillbirth from happening. And they thought, you know, if we save one baby, that's great for us. That'll help us fulfill our mission. And so in there, as they were working through things, they came across this study, the Norway study. And what this is, if I could just summarize this really quickly, is in the country of Norway, expectant parents were educated on figuring out what fetal movement looked like for their pregnancy. And they were monitoring that movement. And if they noticed a change in the pattern or the strength of the movements, they were told to contact their provider, get into the hospital to be seen to assess the health of the baby. And so that's what this study is based on, because this study proved that they could prevent 30% of those deaths from occurring. As they looked at that data, they had this reduction in rates, which is so significant. So in Iowa, our campaign began, and around, the mid what do we call that? The 2000 odds. So our campaign was implemented, and what you see here is the data. The red at the top is the United States rate, and those teal dots are the Iowa rate. And you can see that there's some variance there. We always attribute that to, you have to look at long-term trend lines, because there are things like a syphilis outbreak, a pandemic that occur that can create changes in access and change what happens in maternal health outcomes. But overall, you see a downward trend line in our rate. And so that's really important. And that's the success that we are trying to replicate. So when I share the slides, there'll be a QR code in there to our specific research studies, if that interests you, if you want to get into the weeds of research, that we are absolutely welcoming any questions that you have about that research. We'd love to talk about it. But summing up some of those stories, this is a quote from one of the papers that you can see that we really should be educating pregnant women about what fetal movement, what patterns, how to establish those patterns of movement, and how to report that abnormal activity to health professionals. So that's a big highlight. Additionally, for nurses to be aware of, we've recently collaborated with A1. And you are probably all familiar with who A1 is, but they released a practice brief addressing the decreased fetal movement protocols. And so one of the quotes that they have in here in the practice brief is that focused assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians is essential for improved fetal outcomes. So we'd love for you to scan this practice brief and see what applies to your practice, whether you're in a clinic setting or a hospital clinic. There are OB triage guidelines that are included in this practice brief. So something really important, in our opinion, to take a look at and to address. And then also, here's some more research. So sometimes we get asked about addressing anxiety. So the research studies that we have seen on this, we're not finding that there's an increase in anxiety. The researchers are showing us, these are two highlights that you can see here. Research is showing us that there's actually an increase in awareness and bonding between that mother-baby or expectant parent-baby dyad, and that users of our app are reporting less anxiousness as they are tracking fetal movement. So they're having more confidence. And something that Rose, who was in that video you just watched, is really big on is, as practitioners, we need to trust the intuition of our expectant parents. If they come to us and they feel like they want to be seen, they know something's different about their change in movement, then in order to reduce disparities, we need to listen to those voices. And so I think that's a really important takeaway for me as I've worked with Rose, as I've participated in the research that goes on. We need to allow expectant parents to share their concerns with us, and then we need to be equipped as healthcare providers to address it. So just another baby story that I want to share with you. This is Mabel, and you can see Mabel's mom is sharing her story, and right there in teal, that highlighted quote is, the only red flag in Mabel's pregnancy that there was a problem was a change in Mabel's movement. So we just hear this over and over and over. We get baby stories frequently, and we hear the same thing all the time. So what are some tools that we can give you today to talk about with clients, maybe to talk about with providers or in your line of work? We'd love to share with you, whoops, let me get rid of this one real quick. These are the materials that are free in Maine, and free thanks to our sponsorship with the Maine CDC. We have educational materials. If you scan this code, I think Hybels will probably put a link in the chat. We'll give you a couple minutes to order materials and to take a look at what we offer. But just to highlight, all of the materials are available in English, Spanish, Portuguese, French, Haitian Creole, Lingala, Arabic, Kinyarwanda, and Somali. So all of these languages are available. They're also available in our printable Kit County charts, and I think Hybels will also throw that link in the chat for you. So I'll play some music. We'd love for you to go look at orders, and we will give away 2 $25 gift cards.
Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Because
All right. I have the hardest time stopping things not after a chorus. It's just me. So let's talk a little bit more about tools that you have and how to have this movement monitoring conversation. So you may be asking yourself a little bit, hey, Sarah, why does movement matter so much? Well, I want to share with you that babies are very much like us as adults, as humans. And when we don't feel good, we don't want to move. So if you have ever had the flu, if you have had COVID, you feel sick, you just lay on the couch, you don't want to move. That's exactly what we believe, what research tells us that babies do. And so if you were to give if I were sick and you were to give me a Dr. Pepper and say, okay, you got to do this, drink this caffeine up real quick and get going, I could absolutely do something, but I would not feel good. It would not be a true measurement of how I feel. And so that is why that's a myth that we bust oftentimes, is that people say, oh, well, drink some water, see how you feel, drink some caffeine, eat something, see how you feel and see if those movement patterns change. We do not want that conversation happening for folks unless it's a provider directing them to do that in OB triage. When someone is having reduced fetal movement, we want them absolutely to go to their provider and let them know. Okay, so also about this movement, these are kind of our 5 tips that you can share with folks that you're working with to help kind of move the conversation along. I would recommend, if you're a nurse manager or if you're working with nursing staff, this is really easy to do as a professional development. So to kind of level set the education for what you want people to know about fetal movement monitoring. So the first thing is we want everybody to count for every pregnancy. Right off the bat, there will be differences between babies and pregnancies. And so sometimes we hear another myth that we bust is, well, I already know how to count because I did it with my first pregnancy. Every baby is different, just like every human is different. So every pregnancy should be counted for. So starting in the 3rd trimester, what we want folks to do is be able to start to get familiar with their movement patterns. We want them to download the app. We want them to get a hold of an account and use our web counter. I think that's another thing Hybels will put in the chat for you today, is a link to our web counter. So if someone doesn't have their own phone or no access, also that downloadable fetal movement monitoring chart, the printable kick chart, has great instructions on it. So in whatever way, we want people to become familiar with it. So once they know what movement feels like, so we've told them that, guess what, you're going to count everything but a hiccup, because a hiccup is an involuntary movement. We want them to find a time of day that their baby is most active and they have time to monitor it. So sometimes that's lunch. And so sometimes it's like right at 9 p.m. when you lay down to read and go to sleep. Whatever that is, each expectant parent should identify that time. And then what they're going to do is just time how long it takes to get to 10 movements. So whether that's the app, the web counter, just writing it down in a journal, we just want them to count, and we want them to rate the strength of their movements. So you may be thinking, okay, well, what about 10 and 2? Or what's like the normal expected pattern? The expected pattern is really independent on each baby. And research tells us, don't get concerned about this 10 and 2. Research actually says monitor for each baby. So after a few days of doing this getting to 10 counts, someone is going to be able to see what their pattern looks like. It may be 2 hours, or it may be 17 minutes. For some folks, I had some lady tell me a couple weeks ago that it was 3 minutes, that her baby always got 10 kicks in 3 minutes. And she's like, I just learned that my baby is super active. So again, recognizing intuition and independence for each pregnancy. So we also want folks to know that they need to call their provider right away if they notice a change in not only how long it takes to get to 10 kicks, but how long it takes that baby to get to, I'm sorry, the strength of the movements. I was going to repeat what I said. The strength of the movement. So if you often get some pretty significant jabs and kicks, and then all of a sudden it's just a little bit of a flutter and you're having a hard time telling if that's even movement, that's something to let your provider know. That's something to say, hey, this pattern has changed and I would like to be seen. So this is our app. So as you learn those steps to count, this is the app. This is our Hallmark tool. It is completely free and it is available in over 20 languages. So all those languages that we shared with you, materials are available. The app is also available in those languages and more. So it's available in Apple and Android. We are about to put the Apple Watch back in place for counting. And so just so you know, there are multiple opportunities to use the Count the Kicks resource. And so when you get these slides, you're absolutely welcome to copy that QR code to share with families. But also, all of our materials have a QR code to download the app. So just wanted to provide that context. And because everybody seemed to be familiar with Count the Kicks, I'm not going to spend a whole lot of time on that. But I do want to talk about a systematic implementation. So what does this look like in your work? So something else that we pull out, and I want to launch a poll at the same time as I'm talking about this, is, there we go. I'm going to see if you have some thoughts related to stillbirth prevention in your work. But we know from research that 87% of Count the Kicks app users say their provider is the most important source of information for them. So if their provider tells them, hey, speak up if there's a change in movement or a strength in movement, then we know we can have more confidence that that will actually happen. So providers are critical to this conversation. And nurses, you're a provider. So we want you to feel like you can talk about fetal movement monitoring with the patients that you see. So here are some other ways that this can be implemented into the system. So not only just talking about the app, but think about the discharge process. We actually, if you're a system that's using electronic health records and you have that adaptability, then that is something that we can absolutely help with. We have health systems here in Iowa and a few states across the United States who have integrated this information. So we've got some templates we can share. Just ask us for that. We're absolutely happy to help collaborate on that. Training for the team. So think about anybody that comes into contact with an expectant parent. I am not an expectant parent, but yeah, I go to my family practice office here at the University of Iowa, and when I am greeted and there are maternity patients being checked in, I hear them talk about Count the Kicks, and they have the app card reminders right at the front desk. So they're actually using that point of contact when somebody comes in and they're a maternity patient. They're asking them, are you using Count the Kicks if they're in the third trimester? So lots of different ways to be able to train the team. Something else I'll flag for you, we have OB triage cards that we're piloting. And basically these are it has our app, a picture of our app and a QR code, and I've put it in a 5x7 card that's wipeable, and you can sterilize them. People put them up on OB triage rooms. So if someone's going home, you know, you're sending them home, you're not keeping them as an antepartum patient or admitting them to labor and delivery, you can show them, hey, scan this code. Let's talk about Count the Kicks before you leave as a part of that exit. Those could also be attached to blood pressure, the stands that the blood pressure monitoring equipment is on. You can zip tie that right on there. So think about ways that you can just get the message out. That's really another important step. So thinking about if you are doing case management, if you're doing intake or family care, include information in those after visit summaries. Just a checkbox. Hey, we've talked about Count the Kicks. We just want to make a note of that education has been provided. Procedure downtime. So the dreaded glucola testing, that's a great opportunity to say, hey, have you downloaded the app? You know, and depending on where they are in the timing that they're getting a procedure or a test done, it may be just a conversation, you know, at 16 weeks about what the app is, and hey, just download it and get familiar with it. So when you get to 28 weeks, you start counting. And by the way, if I failed to mention this, you can use the app to count for twins too. So that's another thing that's an important nursing education component. So finally, we have audio recordings and waiting room videos that you would be available to you. Just email us and ask us about those opportunities. We're happy to set up licensing agreements and get those over to you just to get the word out. So I've talked a little bit about misconceptions, but just want to reiterate here. And I say that we've got a question in the wonderings. That's great. I'll come back to it. Just reiterating that every baby is different. And so this adage, I mean, when I was in nursing school in 1998, it was 10 and 2. That is outdated information. And we just want to recognize that every baby will have its own pattern. And it's important to get to know that baby's pattern. So this is also something that I addressed a little bit earlier, but if baby isn't moving, sometimes they hear, you know, especially from the grandmas, I should drink something cold or eat something that's going to stir up the baby. This is absolutely something that a provider should be in that conversation or as a part of the OB triage protocol. But that should not be something that we're giving as education. If somebody notices that there's a change in movement, we want to get them to their provider. We want them to call their provider. We want them to engage in whatever chain that is. Let me just take an opportunity right here to speak to rurality for a second. If your healthcare system is in a place where it will take people time, hours to get to, and I know that's true in Maine, then think about as a nurse, what is the conversation that you can have about a protocol? Do you want to tell maternity patients, expectant parents that, hey, if you notice changes and it's going to take you 2 hours to get to the hospital, get en route and call us while you're en route because minutes matter. So establish with providers what they want to have as an outcome if somebody's experiencing this, and then provide that education to folks prior to them needing that education, just so they're aware. So I hope that makes sense. Again, throw any questions in the chat. And let me see if I can get into this wondering here. Got a chat. Will birthing people, okay, this is a great question. Will birthing people call providers more often by using the app or less often? Hopefully you saw that research. What we see is that people feel empowered to judge when they need to call versus, I don't know. So if they notice that the pattern is different, if they're seeing on the app, this is such a great question, and I hope I can answer this in a way that makes sense. If they're noticing a change in the pattern and we have provided them with that education, we want them to call at that point. If someone is not doing fetal movement monitoring, what I frequently saw at the hospital were people that would come in and tell me they hadn't felt their baby move. But when I asked them about that pattern, I said, well, do you normally feel this in the morning? Oh, I don't know. And I don't know when the last time I felt. Like they really just didn't have that education. And again, as you know, nurses and providers, we want to respect that intuition that they're upset and we want to allay their fears. But really, what we've seen with the app is that folks tend to know their pattern. And so they're going into the hospital when it's needed versus those unnecessary calls. So I hope I answered that question. If not, throw something into the chat. And does the rate of cesarean sections increase with the use of the app? Now, I can't point to a specific data set for this. I'd be happy if you want to email me or if you want to ask me, in the chat, if you want to provide me with that information, I can follow up with specific research studies about this. Overall, we are seeing an increase in the United States in some of the C-section rates, but we do not have a correlation to the app, right? So I want to make sure that I provide some information that's evidence-based about this question. So feel free to put an email in the chat and I can circle back to you. But we are not seeing any definitive evidence of that occurring. Okay, I think I got those questions. So let's talk about next steps. We're coming to the end here. I just want to make sure that when you think about your nursing practice, familiarize yourself with Count the Kicks app. practice doing it yourself. So I have downloaded the app, and like I said, I am not an expectant parent, but I'm pretty good at using it. I've gotten familiar with what resources are available. If you have not been on the app and looked at resources, we're connected to Find Help. And that is an opportunity for people to identify their needs with resources by zip code. So if someone's experiencing food insecurity, they can go look for food pantries that are close to them by zip code. So get to know what's on the app so that you can speak to that with your with the patients that you serve. Ordering materials, I'll put it up one more time before we go out here today. And then, go the extra step and designate someone. If you're in a practice, say, who's going to be the person that keeps an eye on these materials and making sure we're stocked, or that we know where to get other language materials from. Designate that person. Think about the education process that you want to have. We want every expectant parent who is coming in and being seen at that 3rd trimester, every time they're being seen, hey, are you monitoring fetal movements? Are you using Count the Kicks? We want that conversation to continue, because the more that we are getting that message out there, the higher success rate that we will have. Make sure the entire staff knows about the campaign. I feel like I've kind of covered that one, but we just feel like it's really important for every single person who's having that touch point to be involved in that Count the Kicks education. Debunk misconceptions and encourage people to speak up. So again, going back to what Rose said about trusting intuition, really important for folks to be empowered to speak up. And also, sometimes the grandmas and the aunties don't have the right information and the most accurate and evidence-based information. So debunk those misconceptions when you come across them. Feel free to email us and say, hey, we heard this. We will do the research. We'll help you come up with a response. We're happy to help with that. And then finally, remember that hours and minutes matter. That's what I spoke to earlier about the rurality of your practice. If it's going to take people a long time to get, do we want them to just go on and get into the hospital, make their way in there so that we can save lives? We absolutely want to expedite concerns about fetal movement monitoring. So this is a really important step. So I think that kind of covers what I was thinking about for nursing. I'd love for you to put in any questions that you have in the chat. I'm going to share with you again. Actually, let me go here. I'll show you our at a glance materials. So these are available in all of those languages that we shared today. You can see just how simple this message is, reinforces calling a provider. And I will leave this part up here at the end one more time, because we want to get people to the materials. We want to have them absolutely available. And as we go out, and I know Shauna just popped out. Shauna is one of our community advocates, but let's just talk about 2 important women in Maine. So you have Morgan Miller and Shauna Goulet, and they are absolutely folks that are educated about Count the Kicks. They are in your state. Sometimes they're available to do, education components, boots on the ground kind of thing, answer questions about Count the Kicks. They're advocates for fetal movement monitoring, and we really are thankful for their partnership and leaning into our work together. I'll share with you our social media channels. We just had some legislation moving through the House at Healthy Birthday, the Maternal Health Stillbirth Prevention Act. We are excited about sharing those updates with you through our social media channels for Healthy Birthday. But if you're looking for parent information, parent-centered information, we have lots of tools for you, free material on the Count the Kicks app. On the Count the Kicks media platforms. So I will share this video with you, and then we will stop. I will stop talking. I know I'm talking 100 miles a minute, but I want to share this story from an expectant parent. This is Destiny's story.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks just, I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
Okay, so thank you so much for joining with us today. I'm happy to answer questions. I think that Kim may still be here. I know that she can answer any questions that you have as well. If you don't have questions, just thank you for being here today. Thank you for learning. You may absolutely pop out. Otherwise, I will hang out here for just a minute. And thank you again to Maine CDC for sponsoring us and helping us get the program here. Check in the chat. I think good. Think we're good. All right, everybody. Thank you for joining us. Kim, do you want to say anything? Okay. All right. Everybody have a great day. We are going to stop it and stay safe.